I've just started a new therapy group for procrastinators. But yeah, we haven't even started our session yet. That is one thing. But recently, my cat, she lost her tail, and I told my psychiatrist, my psychologist about it. You know what she said? She suggested retail therapy. That was actually a very great response from her. And I also joined a new therapy group for loneliness, but nobody turned up. But that's okay. It's not something new. The reason why I went to therapy is also because my boyfriend suggested me to. He said that I had a very big ego. I think it worked when I went to therapy. I'm feeling way better than everyone else in that group, honestly. And recently I have been taking my psychiatric medication. Well, at least it doesn't feel as bad as stealing it. So now I think you can see what I will be talking about today, and that is psychological disorders. What is psychological disorder? Psychological disorder is a condition characterized by abnormal thoughts, feelings, and behaviors. Psychological disorders are also referred to as mental disorders, which they are abnormalities of the mind. The result is persistent behavior that can seriously affect their day-to-day function. And multiple psychological disorders may exist in a person, in an individual. The specific cause of psychological disorders are not known, but it is when a person experiences mood or cognitive problems or behavioral issues for a very long time, for a very long period. And a psychological evaluation may be beneficial for them. According to the American Psychiatric Association, APA 2013, a psychological disorder is a condition that is said to consist of the following, which is, firstly, there are significant disturbances in the thought or in the feelings and behaviors of a person. Next is this disturbance reflects some kind of biological or psychological or developmental dysfunction of an individual, and the disturbance lead to significant distress or disability in one's life. The next is the disturbances do not reflect expected or culturally approved responses to certain situations, to certain events. Next, we will be talking about what are the types of mental disorders. Mental health disorders, psychological disorders occur in a variety of forms, and symptoms can sometimes overlap, making it somehow slightly hard to diagnose. However, there are some common disorders that affect people of all ages. First one is ADHD, which is attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder is the inability to remain focused on a task, the inability to sit still. Someone who has impulsive behaviors and they tend to do excessive activities. And although this disorder is most commonly diagnosed in children, it can sometimes or most of the time occur in adults as well. The next disorder is anxiety or panic disorder. Anxiety disorder is defined by intermittent and repeated attacks of intense fear of something bad that might happen, or a sense of death or impending doom. The next disorder is bipolar disorder. Bipolar disorder causes a periodic cycling of emotional states between manic and depressive phases. Manic phases contains period of extreme activity, excessive activities, and heightened emotions, whereas the depressive phase are mostly just lethargy and sadness. The cycles do not tend to occur instantly. The next disorder is depression. It is something that we commonly hear. Depression covers a wide range of conditions. Typically it is a persistent bad mood and the lack of interest in pursuing daily activities. And dysthymia is a milder form of depression, but it is much longer lasting. It is sometimes, existential crisis. You do not see yourself in the future. You feel as if you do not have a future. And the next disorder is schizophrenia. Schizophrenia is not as commonly thought. It is solely about hearing voices or having multiple personalities. Instead, it is defined by a lack of ability to distinguish which is reality and which is not reality. Schizophrenia can cause paranoia and belief in certain conspiracies on that certain individual. Now, what are the symptoms of psychological disorders? Symptoms of psychological disorders vary based on the specific disorder, but surely mood and behavioral symptoms are very common. Symptoms can sometimes be very chronic and relapsing, and it can interfere with your inability and ability to interact with society. Common symptoms of psychological disorders are mostly agitation, someone being very hostile, aggression. There are certain cases where alcohol and drug abuse are involved, alterations in energy levels, confusion or disconnectedness, irritability, your mood changes very rapidly, and this one is the one that I mentioned in regards to schizophrenia, which is psychosis, which means perception or thought process disturbances, such as hallucinations and delusions. And sometimes it can also happen persistently, or abrupt mood changes that can interfere with your day-to-day activity. And the other one is problem denial, someone being very, they tend to gaslight themselves in regards to their problems, and also social withdrawal. Physical symptoms may also happen in regards to psychological disorders, which is lethargy, sleep disturbances, insomnia, weight and appetite changes. Sometimes serious symptoms that might indicate a life-threatening condition can also happen. In some cases, psychological disorders can be very life-threatening, or the individual itself is being life-threatening to another person, includes irrational or suicidal behavior. They are unable to care for one's basic needs, or they may have trauma that is very visible on their body, such as bone deformity, burns on their skin, eye injury, and other injuries. Next is what actually causes psychological disorders. The causes of psychological disorders are not specifically known, but a number of factors are thought to influence the development of psychological disorders, such as the chemical imbalances in your brain. Next is what are the risk factors of psychological disorders. Not all people with risk factors will get psychological disorders, but some of them are very common, which is firstly is abuse or neglect as a child, which started at a very early age, childhood problems with temperament, family or personal history of mental illness itself, or substance abuse, which the child may experience or has seen people around him or her experience, intelligence below normal IQ, low birth weight, lower socioeconomic status, parental absence, parents who are involved with criminal activities, or they themselves are involved with criminal activities, or substance abuse, prenatal exposure to alcohol, to drugs, and social disadvantages, stressful or traumatic life events, and also substance abuse. How are psychological disorders actually treated? The first step in the treatment of psychological disorders is actually recognizing that the problem exists, that it is okay for you to have that problem. Usually people who have psychological disorders are very much in denial. They tend to gaslight themselves. They tend to not say specifically that I have a problem, but regular medical care can be very helpful, because when you're not in denial and when you get help, it allows a healthcare professional to actually provide early screening tests where your healthcare professionals can evaluate your symptoms and your risk of developing the specific psychological disorders. Common treatment for psychological disorders also include anti-anxiety medication, antidepressant medications to improve your moods, antipsychotic medication to treat disorders, thought patterns, and altered perception for people who experience schizophrenia. Cognitive behavioral therapy to work on thought patterns and behaviors. Family therapy to help develop and for you to have extra support and understanding from other people outside of your family. Individual therapy, mood stabilizing medication, support groups, and also talk therapy. Properly treated, people who have psychological disorders often improve. However, relapses and downfalls are pretty much very possible. But if left untreated, some psychological problems can lead to academic, legal, social, and also work problems. Thank you.